Hello everyone. In this video, we will talk about the fungal infection blastomycosis. Blastomycosis is also known as North American blastomycosis. The causative organism for this disease is Blastomyces dermatitidis. Blastomyces dermatitidis is a dimorphic fungus, meaning that it exists in two forms. At 37 degrees Celsius, which means at body temperature, it exists as the yeast form, and at 25 degrees Celsius, which is at room temperature, it exists in the mold form. So blastomyces is a dimorphic fungus which exists in two forms, yeast and mold. Now, blastomyces is responsible for blastomycosis, which is a systemic mycosis, which means that it involves the organ systems. And the main systems involved in this disease are lungs and skin. So the lungs and skin are mainly involved in blastomycosis. If we look at the distribution, this disease is mostly found in North America, but a few cases have been reported from Africa and India as well. The mode of infection is by inhalation of contaminated soil. This is how this disease is acquired. Now let's look at the clinical features. Most cases are asymptomatic, but when symptoms do exist, the lungs will be involved, causing a TB or a histoplasma-like disease. So that is what the patients with blastomycosis will present with, a TB or histoplasma-like disease, where there will be consolidation or miliary type of lesions. If you look at the skin, there will be papules and nodules on the skin. A more disseminated form of the infection will lead to abscesses, hepatosplenomegaly, and lymphadenopathy. So these are the clinical features: TB or histoplasma-like infection of the lungs, papules and nodules in the skin, abscesses, hepatosplenomegaly, and lymphadenopathy. For the diagnosis, at room temperature, we will see the yeast forms. The yeast forms will be spherical, thick and double-walled, and there will be broad-based budding yeasts. This is the characteristic description: broad-based budding yeasts. So this is how the organism will appear in the yeast form. At 25 degrees Celsius, which means after culture, what we see are filamentous mycelia with septate hyphae, and they also contain round or oval conidia. So this is how they will appear on room temperature. For the treatment, for milder forms, we will give itraconazole, and for more severe forms, amphotericin B.